Welcome to USMLEFasttrack.com. The section we're going to talk about today is from First Aid for the USMLE Step 1, 2013 edition.
Page 212. Necrosis. What is necrosis? Necrosis is defined as enzymatic degradation and protein denaturation of a cell resulting from exogenous injury. One thing to note about necrosis is that this is not a type of programmed cell death, so that means there is inflammatory process that does occur because this is not a natural process, and in this, when there is an injury, the intracellular components will extravasate, and extravasate just means that it will squeeze out basically. Name all the different types of necrosis. The different types of necrosis includes coagulative necrosis, liquefactive necrosis, caseous necrosis, fatty necrosis or fat necrosis, fibrinoid necrosis, and gangrenous necrosis. Name the organs where you typically see coagulative necrosis. You see coagulative necrosis in the heart, liver, and the kidneys. Where does liquefactive necrosis occur? Liquefactive necrosis can occur in the brain and the lungs, and it happens due to bacterial abscesses and pleural effusion. Define pleural effusion. Pleural effusion is excess fluid that accumulates in the pleura, and pleura is the fluid-filled space that surrounds the lungs. In what situation can caseous necrosis occur? Caseous necrosis can occur in tuberculosis and systemic fungal infections. Define fat necrosis. Fat necrosis is a type of necrosis that occurs due to digestive enzymes such as lipase. What are some conditions that can lead to fat necrosis? Fat necrosis can happen in trauma as well as in acute pancreatitis. Fat necrosis can also happen in the breast due to a traumatic injury, which could be a sign of physical abuse. Where is fibrinoid necrosis generally observed? Fibrinoid necrosis generally occurs in the blood vessels. Where does gangrenous necrosis commonly occur? Gangrenous necrosis commonly happens in the limbs and in the GI tract. What is dry gangrenous necrosis? Dry gangrenous necrosis is a ischemic coagulative gangrenous necrosis. What is wet gangrenous necrosis? Wet gangrenous necrosis is when there is gangrenous necrosis with bacteria.
For more information on this topic, click on the link in the description section below. For a full USMLE Step 1 review, be sure to check us out at USMLEFasttrack.com, where we help you review the entire first aid for the USMLE Step 1 with high quality videos and hundreds of detailed pictures for a better understanding of the material. So to learn from the best USMLE review book, be sure to check us out at USMLEFasttrack.com.